And welcome back. You're watching Prime Edition. The government says it is ready to roll out the Social Health Insurance Fund by the 1st of October, which is less than 2 weeks away, despite only 1.2 million of the projected 44 million Kenyans registering on the new platform. County bosses who met top officials from the Ministry of Health ahead of a rollout called for innovative approaches to entice more Kenyans to register on the new platform. This comes as the court is expected to this Friday deliver a ruling in a case challenging the validity of the rollout. Our reporter Abdiaziz Hashim has details of the government's race against time to shift to the Social Health Insurance Fund despite the challenges.
Barely a day after President William Ruto appointed Dr. Abdi Mohammed as the Social Health Authority Board Chair to take over from Timothy Olwenyi, who has since been moved to chair the National Cancer Institute Board.
We now know who is in the house. CS on your...
The Ministry of Health convened a meeting with county government administrators and journalists. It is at this meeting that it emerged that the Ministry of Health officials are currently working hammer and tongs ahead of the rollout of the Social Health Insurance Fund, which is 12 days away.
So far, we have done 1.2 million, and we're still pushing.
The Council of Governors Health Committee Chairperson and Tharaka Nithi Governor Muthomi Njoki challenged the ministry to come up with innovative ideas to enhance the registration process.
Go out there and say I have a meeting tomorrow to register SHA. No one will come. But tell them I have a meeting where I'm giving some goodies from government. They will be there, all of them.
Is a very critical person in this process because they will assist through the registration, which is very critical, and especially at the bottom of the pyramid, at mashinani level.
Cabinet Secretary Deborah Mulongo Baraza urged Kenyans to register, arguing it will enhance healthcare services.
We will continue improving the system, we will address the funding gaps and enhance digitization efforts to improve healthcare delivery and data management in Kenya.
Our figures now go to daily average is about over 60,000 Kenyans are registering daily.
This coming in the wake of a court case challenging the implementation of the fund.
The ruling of that is going to be delivered on our application for stay of order, which you have requested the court to grant us.
With the courts expected to make a pronouncement on the same this Friday.
If the ruling will be that our request be granted, then that means we have time to continue implementing this act and these laws and until the case is heard and determined. If our request will not be granted on the 20th, then that means we'll go back to the 120 days where Parliament had been given time to reenact these laws.
Abdiaziz Hashim for Prime Edition.